And we are recording. Hi, everybody. This is Rajam Roos, the CEO and founder of the San Diego Pain Summit. And I am here with Michael Falcon, who we actually met at first at the recent 2019 San Diego Pain Summit because he's working with Sharna Prasad, who's a physical therapist, on a pilot program. And I wanted to bring him on here to tell you guys about it. And hopefully you will get some inspiration from what they're doing to maybe have some ideas of doing this in your own community. And a little bit about Michael. He received his doctorate degree in occupational therapy from Pacific University, along with a master's degree in healthcare administration. He currently works with pediatrics in the school setting and serves on the legislative committee in the Occupational Therapy Association of Oregon. He has a passion for international occupational therapy and program development. His previous work includes program development for children with socialization deficits in Ecuador, trainings to local medical communities in Ibarra, Ecuador. Did I pronounce that right? Ibarra, Ecuador, and fieldwork educator and humanitarian work in Haiti. He has also presented at conferences such as the AOTA 2016 in Chicago. He's presented at Cape Town, South Africa, and is a scheduled speaker coming up at OTAO 2019 in Lincoln City, Oregon. So thank you so much for joining us, Michael. And just to get started, you know, as I mentioned, you know, you're working on this pilot program with Sharna Prasad, and basically you're doing it at a high school to help students and teachers as well, to help them understand pain from a biopsychosocial perspective, as well as educating them on opioid use. And can you tell us a little bit about this program and like start off maybe with what gave you guys the idea for it and how you're currently implementing the pilot program?
Yeah, well, so I think the original idea was decided prior to me. I was brought on after the school and really Sharna had applied for the grant and this idea. And for those of y'all that know Sharna, know her passion about the subject. And, you know, she's probably the one that really got the ball rolling. It started off with her giving presentations at the high school that her children attended. And obviously all around the subject of pain and opioids. And it started as just a single presentation, one class come in once a year type of thing. And, you know, the teachers and even the students kept asking for more, and it kind of grew and developed into what we have today, which the grant in and of itself is composed of a number of different pieces, but the pieces that she and I are working on specifically is the development of a curriculum, an actual class for the students that would be implemented by the teachers. The class covers opioids and opioid facts, especially specific to Oregon. It covers, you know, obviously the dangers and things of that nature with them. And then we go into talking about pain and better understanding pain, especially as it's attributed to their age group, at their adolescent age. And I'm talking about freshman students for this year. And then it goes on to developing or helping them develop strategies for coping and how to address some of the pain and the concerns that they have within their lives today. And so we developed curriculum around those subjects. We developed full PowerPoint presentations. We have step-by-step activities that correlate with each individual activity. That was really where I was able to sort of lend my OT mindset and just go crazy with it. And then, so we create the curriculum, and then we've done a training with the teachers who, again, will be implementing this. And then we will have another training coming up in the fall, I think in October, early October. And then the course itself will go over, I think it's a 5-day course that will be implemented into their already scheduled health curriculum. And then, yeah, we'll go from there. It'll be implemented this fall.
And so I know you said, and I think I remembered her telling me this too, that Sharna She actually started doing this as an annual course. Do you know how she approached the school, or did you both do it together? Do you know how she approached them and then what that process was like?
Yeah, as far as I know, it was just Sharna being herself and advocating for herself and going into schools and saying, hey, I have this skill set, which obviously her work in the clinic where she's working, working with adults in pain, she felt that there was a need there, especially, having her uh, her children attend there and having friends of that nature that had dealt with some of these issues, especially with the opioids starting to be introduced into the high schools a bit. And it was just an area that she felt passionate about, and she approached the school, and that's kind of where it started.
So what is it about working with high school students that you find most appealing, that's kind of driving you with this program?
Well, there's a couple of things. I think for myself, there's a personal aspect to it. I'm an amputee, and so going through that process, I was just out of high school when I lost my arm. And I dealt with chronic pain 6-7 years before I could finally, where I feel like I've managed it. And so when I heard that Sharna was doing something in the high schools, dealing with pain and talking about pain with the understanding that I have of it now, it was just such a huge personal attraction to me. And then, in retrospect, thinking about, what high school students are like, especially at that age, there's just this, very everything is about me mindset that's happening. And it's exactly what someone who is dealing with chronic or persistent pain is like. You go through that struggle of, why is all this pain happening to me? Why do I have to go through these struggles, regardless of what they are? And I felt that that's a really appropriate population to at least get this thing started.
Yeah, and that makes a lot of sense too. Just from a personal standpoint, my husband was a high school educator for a decade, a little bit more than a decade. And it seems like at that age, kids are they're more like sponges, ready to learn. But again, as you've also said, I remember my high school days, the world revolves around us. And of course, research shows that the more we think about our own pain, our own situation, actually, makes our perception of it, it increases our perception of it. So that's a really interesting point. And when you were implementing the program, what are some of the mistakes, if there were any, that happened that in hindsight you were like, oh, we should have known how to do that better? Because I'm sure you're tweaking along the way because it's a pilot program. But can you share some of those with us?
Yeah, well, some of the things that have actually just come up here recently, Sharna and I just met actually last week. One of the things that we have been thinking about is, okay, so we've done this one training with the teachers, and then all of a sudden we're expecting them to have a really good grasp on what it is that we've shown them, and then being able to take the passion and then the amount of knowledge that we have and then give that over to students in a way that would be meaningful to them. And that's a big expectation for anybody, let alone, working clinical professionals with the knowledge that we had versus, teachers who do not have the education that we have. So there is that piece there that we've been sort of trying to figure out, how it is that we're going to address that. One of the things that we're thinking about is, adopting or having a champion or two at each school that we, on a one-on-one basis, continue to provide education and continue to provide training. That way teachers can come back to them, or so that our champions can go into the classroom, evaluate, and make adjustments along the way as the program continues to solidify. And then as it progresses on into future years, one of the things that's also come up is that we had to think about is that these are going to be implemented into health classes, which by and large the teachers that that present that curriculum are a lot of the PE teachers or the physical education teachers And there tends to be a turnover with that staff, much more so than, say, your history teacher who's been there for 15, 20 years. So that's another piece that we had to think about, which makes, having a champion much more, I don't know, it allows some longevity with the program within each individual high school. So that's one of the things. But yeah, like you said, there's constant tweaking that's happening. Even over the summer, we're still working on things, trying to make some of the curriculum much more appropriate and making sure it's accessible to the students, especially where they are. We're talking about freshmen. So there's some of those things that we have to deal with just age and maturation.
Hormones.
That's one of them.
I noticed that you call, so it sounds like this is in multiple high schools, not just one.
Yeah, so we are serving the Corvallis School Districts, which has 2 high schools in it that I know of. And then there is, we also had interest during this training. We invited other districts as well if they chose to do so. And there are other districts that showed interest as well. So there's anticipation that we'll be spreading out a little bit.
And I noticed that you call the, I guess the consultants, if you will, champions. Is there a reason that you chose that term?
Not particularly. I mean, they can be point of contact, they can be whatever it is. The point is that they would be the person that we really try and educate to as much as possible, not only about just what the education is and what the facts are, but really how the layout of the class should look and how it should be presented, especially to students. What types of guiding questions we want our teachers to be asking in certain situations, things like that. It's really hard to get over in a training and a half. It's not something I would expect any teacher to be able to do. So it's just really a way to make sure that we have someone there who has a firm grasp of what it is that we would like to see happen, and then be able to implement that.
Yeah, I just like the term champion because I think there's something about the language that we use. My sister is organizing some sort of similar, not exactly similar, but she's organizing a training to help teachers understand how to work with students who are coming from impoverished backgrounds. And she's calling it it's a weird name, but it's what she says, like, it gets the least offensive pushback to so when you said champion, it may, that sounds really good. Like when you hear they're a champion, it automatically puts them in that leadership role. And it's hard enough when you're talking to clinicians about this information. I can't imagine what it's like talking to a lay person, although sometimes they seem to understand these things a little bit quicker because they don't have all that training behind them to prevent.
That's really true. That was one of the things that I came into already thinking about, was that very point. I mean, talking with clinicians in general, it's really challenging, especially those that have been in the field for a while. There's just this mindset of this is how things are done, and this is these are the facts, and so it's really challenging to deal with that. One of the things that I think we've been really fortunate with is our 2 sort of point people that we've been working with in the district have been really passionate about it. So they've been really open to what it is that we're saying. One of the things that we did with our training, and this was intentional, is that we curtailed the curriculum a bit to be much more geared towards adults and adult issues. So thinking about, coping with the stresses of children, the stresses of students, the stresses of bills, all those different things. That way they could relate to it and adopt to the concepts that we were giving a bit more. And then that way they can turn that around and present to the students.
And so how do you so I like that perspective too. You're bringing it on their level. So you're teaching them about pain and stress from an adult level. What are some of the tools you use? Like, do you use video, or do they take any kind of test? Like, how do they demonstrate that they understand this information?
Yeah, so what we did a number of things. So we have some very general, just information type videos, especially when it comes to opioids and things like that. What we did do is we made sure that we found as many statistics as we could about current opioid use that's local here to Oregon, which unfortunately is substantial at the moment. And then seeing what those numbers were like in the schools as well, just so that there's just this overall awareness, and so that we weren't assuming anything either. And then we developed a number of activities. One thing that we did that I'm really proud of was we created these, sorry about that. We created, my goodness, I'm forgetting what we called it. We created these activities. Let me find it real quick, actually. Case studies, my goodness. Case studies, you know when you're blanking. What did we create?
That's okay. I'm getting older and I'm forgetting a lot of stuff.
I know, I'm young, so I do not have that up. So we created case studies that were varied in their experiences and what it was that they were going through. And I was really intentional on pulling out as many different types of stressors that I could think of. So we can, and I played on a little bit of everything. I played on SES status, socioeconomic status. I played on number of children that they may or may not have as adults. I played on whether or not they themselves are dealing with a chronic or persistent pain, which is being medicated. I played on bills. I played on a number of different factors and stressors. And then we presented these activities or these case studies with them along with activities. And so out of the activities, they were asked to pull different variables from them. So some of the questions were like, you know, given this case study, what types of things does this person have to stress about? Now there are some things that they can pull out verbatim from the case study and say, oh, this is stressful to them. They have 5 kids or whatever. But because it is, you know, internalized and it's from their own perspective, there are other things that they could easily pull out of that were not said in the case study, but reading between the lines and pulling from their own experiences and perspectives, they can think of other stressors that were there. And we did the same things with the students, and it's just a way of getting them to expand their minds and really pull out from their own perspectives, but still see pain and stress in others as well, and how they could be going through things as well, which is something that I really was honing in on, was the generalization of stress and pain.
Yeah, that sounds really cool. So you've got first you have to educate your champions, correct? Mm-hmm. You find the people who are very passionate. And then when you're setting up to educate the teachers, what does that look like? Is it like an hour once a week? Or how often, how many little lessons do they need before you've noticed that they felt like they were ready?
Right. So as of now, working with our champion has been, it's been this whole year up till this point. Meeting during the school year, we were meeting about twice a month while we were creating the curriculum, while we were creating the activities. And it was discussion back and forth with her, because the other thing that we had to think about was, you know, what does curriculum look like? What is it that we need to make this look like? What standards do we have to have within our curriculum that the school would say, okay, yes, we can implement this? So those were some of the things that we had to discuss back and forth while still being able to input all of our information and education. So our champion was really there with us every step of the way as this stuff was developing. So those conversations were being had already. I think as we move forward, if we were to go into a different district, I think it would probably be a multi-month constant meeting type of schedule with the champion. And then at least 2 to 3 trainings, and these are whole day trainings with teachers where we literally go through the entire course with them. So they're taking a course from us, and we went through every week with them, and we spent 8 hours with them on one day doing the training or the course with the teachers.
Wow. So hopefully when this is successful, there'll be like outlines released and all that. But you know, when you mentioned several times actually that opioid use is a big problem right now in Oregon, and you're seeing it as a problem in the high schools. You know, and based on discussions that I've seen on social media, such as Twitter, between patients who have had their medications taken away from them and doctors who would like to be able to prescribe them. There's all these battles going on. What is some pushback that you have experienced from people who are using opioids who maybe feel like your message is telling them they need to just cut them out? And then how have you managed those types of pushbacks?
Yeah, well, I personally do not really deal with patients who are on or using opioids. From my own experience, having been on them, being addicted to them, I think that's one of the things that we as sort of a nation are really barely understanding, right? Is the addiction piece of them and how addicting they can be. And then that there's other alternatives. I think that's something that's just not known yet. Even within our own clinical community, it's still not known. It's so minuscule. I think when I met Sharna and she invited me to the San Diego Pain Summit, I was honestly shocked being there the 2 days I was there, because I had no idea this community existed, which I think it's really telling. Especially someone who just came out of school, for me not to be educated on this type of information, I think it's pretty telling on how small and still how grassroots this whole approach and idea is, that there's an alternative to pain. And I think, overall, our overall approach to pain in general it's just not right. It's lopsided. So I think there's a lot of education that needs to happen and that still needs to be had. One of the things that was really cool about our training that we did with the teachers was we also invited some clinicians as well if they wanted to show up. And some of the clinicians were parents of students who either will be coming into the freshman class or have students already in the high school. And so when we started giving them the statistics of, how much opioids and drug abuse is actually in Oregon high schools, they had no idea. And so there was simple education there that's readily available. You can go on any of the state websites and find this stuff. And, again, they had no idea that it was there and that it's happening now. And so I think just the education piece is always going to be our go-to.
Yeah, because parents are usually the last to know.
Yeah.
Or anybody really. It's very, I think it's difficult for us to see sometimes what's going on in our own communities, because everything we see on TV, it seems like it's happening elsewhere.
It's over there, yeah.
But so if you, especially when you're dealing with students who may be using opioids, which I'm going to guess mostly is probably illegally, if you do see this type of issue, do you guys have something set up as part of the program on the side that you can get with the parent of that student and encourage them to seek, addiction? And I'm not talking about the students who may be on it and they have a prescription, but I'm guessing that there's a lot of illicit use. Is there something in place to manage that aspect of people that might be going through your program or the class?
Right. So now I'll probably expand out a little bit. So in terms of our program and what our role within the grant was, no, we did not have any piece to deal with that. But within the grant itself, they did incorporate a number of community outlet factors and places where students can go. So they did partner with a bunch of different people, and I don't know the exhaustive list off the top of my head. But they did, and they will be offering, so they got like memberships to like local YMCA, local Boys and Girls Club, local even gyms and things like that. And then also they partnered with a couple, I think like, not psychologists, but something along those lines where the students can go to and talk about some of the things that they are going through. And then I know the data is being monitored by a certain group outside of the school with kids who are already identified as being at risk as well. So there is a lot going on, but I will give a little caveat to that as well. One of the things that I do and we do have to acknowledge is that this program is being done in a community that is fairly well off. When I'm talking if I'm talking about socioeconomic status. So they do have the funds and the ability to do some of these things. So it's going to be interesting, I think, moving forward, what a program like this will look like in other communities. Some that might not have the ability to do and implement some of those things.
Yeah, that's a good point that you bring up, because it is true that the the wealthier communities can afford to have the time and the resources to have extra stuff like this involved. So, but I think it's possible probably to expand it if, when it's successful. So how much longer does the program have, or, how long have you guys been doing it so far?
Yeah, so let's see, I was brought on in, I think, November, December of last year, and we really started really in January, and it's been going on up through now. Like I said, we have another half-day training in October prior to the class, and then the course will be given over the fall, and then the grant goes through December. So at least with this grant, that's how long we have with it, and then we're looking to hopefully find some more grants and get some more money so we can expand a bit.
So, you talked about how some of the students who have gone through the program, their parents have come. Is that something that you try and include more of, like find ways to get more of the parents involved with, because it seems like that would be helpful as well, but it also seems like an extra lot of work.
Yes. So that was one of the things I think Sharna and I had a long discussion about on, who should we include and bring to the trainings. Ultimately, we decided not to invite and include parents and students, and it was hard because part of me wants to include absolutely without question. But I don't know that this specific training was the right place, because we really needed a safe place for the teachers to be able to adopt the information, to be able to talk about students and their experiences with students as well. And so we felt that bringing in students and parents might inhibit their willingness to be open. But moving forward, absolutely, that's definitely something that we want to do. We want to continue to give more information and more education, especially out to the community in general, but especially including the parents and the students with the course. One of the things that we would like to do is get feedback from students, especially after this go around. That way, that can be implemented and expressed to the teachers as well as family and parents as well.
Yeah, that's pretty interesting. I mean, that is a good point, because again, back to my husband, when he taught at a high school, he taught at a private high school, and he had a rule in his classroom that whatever is said in this room stays in this room.
Yeah.
And so the students ended up viewing him as a very trustworthy adult figure that they would felt comfortable coming to him with their problems. So that's a really good point, I think.
Yeah.
I'm curious, like especially when because you were teaching the biopsychosocial aspect of pain, and it sounded like there were a lot of other things involved besides just the opioid, the biopsychosocial pain. I didn't write it down, but I remember seeing there's like a long list of things that you're teaching.
Yeah.
In that class.
Well, so one of the things that we have to, I guess, sort of be aware of it and keep mindful of is where these students are really in their lives, right? They have a number of stressors. They have a number of things that some of us may or may not perceive as being stressful or things to be anxious about, but it's all relative. So in their mindset, they are stressed, they are anxious. And so yes, there's a number of areas that we talk about. We talk about the opioids in and of itself is really just one day, and that's kind of the only day that we talk about it. And it's really just about educating them on the dangers of them and what's going on in the communities around them. From then on, it's about identifying stressors and the factors that are associated with their specific pain. It's about the generalization of pain, that not only am I going through pain, but all of my peers are also going through pain, and identifying different variables that I might call pain and what you might call pain, and the different factors that may influence that. And then we go into identifying factors of how they can cope with these different stressors and the things that they're going through. And so I felt that that was really important. And then generalizing all those factors, right? So that, you know, if reading or cycling or running is a coping mechanism for someone else, I might like to just sit back and listen to music all day, you know, and that might be my coping mechanism. And really opening their minds to just the different variables and the different variances that happen within human beings and in and amongst themselves as well. So there's a lot to it, to be honest.
Sounds it. Yeah, it sounds like it. I'm curious, what has been the most difficult concept to get across of what you've been teaching just to the students themselves? Like, is there something you've noticed that seems to be the hardest for them to grasp? Or
Yeah, so we haven't dealt with the students yet, but one of the things in hearing Sharna's feedback of what she has done in previous years, and then also what we got during the training, the feedback from the training, and some of the answers that we got from our teachers is, you know, some of the simplest things like, what are you feeling right now in this experience? What are you feeling? And the responses that you get for identifying feelings are nothing like what we would expect. You know, I'm feeling warm, or I'm feeling, you know, soft, or I'm feeling whatever. We're not getting those types of responses as well at all. So simple things like identifying feelings, identifying emotions when you're having them, something that I would assume would be really simple, it's just not, and it's being missed. And so really, you know, we've gotten to the point where we're providing a list of emotions and feelings, that way they can have words and ideas to think of as they're presented certain questions or topics. So it's been interesting.
that's funny that you bring that up, because I went through an outdoor program when I was younger, like a counseling program. And one of the things that I had to do was write down all the types of feelings and define each one. So I know the difference between frustration, irritation, being annoyed. Like,
Yeah.
I think that's really cool. When you were talking about how you were having trouble with that, it just brought me back to that memory of having to do that. And it did end up helping me describe what I was feeling more. And it's probably just helpful for them to learn how to, you know, seek within and be more in touch with themselves too.
Yeah, and I think, I mean, overall, that's probably the main piece of our entire program, especially where they are currently now in their lives, is being able to identify those things. Because if they can't identify those things, then there's no way to deal or to apply strategies to cope with those things, because you don't know, you know, what it is you're trying to address or to fix or to solve. So we need to be able to put words to those issues first.
So right now it sounds like you're still just working on training the champions.
Yeah, that's the next step, or that's the step we're currently on. And then again, it will be giving more feedback and then giving the curriculum itself to the teachers. That way they can play with it and work with it for a bit before that final training that we have with them.
And so, you know, I'd asked this about the kids. So now I'm curious about the adults. What has been the hardest thing for them to understand when it comes to, I mean, I understand, especially you've chosen people who are super passionate,
Yeah.
but what has been something that you found was kind of a hiccup and from the adult perspective?
Yeah, I think, you know, if we're dealing with 35, 45, 55-year-old adults, we have, you know, 35, 45, and 55 years worth of experience that we're trying to adjust to, you know, influence in a way, you know, to adopt a different perspective or a perspective that may not be theirs specifically, to be willing to accept the fact that, you know, their students are going through stresses, even if the adult does not see that as a stress, which can absolutely happen, especially when we're talking about the relationship between the student and the teacher. You know, some of those things we might not be able to comprehend. being able to see the value in this overall curriculum in and of itself, and then develop their own passion about it. That way they can relay it to students has been one of the hiccups. One of the things that we had come up during our training was we had a teacher there who was or is one of the, I think he's the football or baseball coach there. And he's, as an athlete, I can say he's a stereotypical, male football, baseball coach, very stoic, very set in his routine. Many of his answers were about, working out, lifting weights and all that. And it was great. And throughout the training, he was just stone faced, and we couldn't read him. We couldn't tell if he was buying this or not. And so we were really concerned. And so we went through 7.5, 8 hours worth of training. It was a really long day. And again, we got nothing from this guy. And so we released everybody and thanked them and stuff. And he came up to me and he started talking to me for about 15 minutes about how valuable he sees this for some of the students that he deals with. He also works with the students who have like the significant behavior problems in the schools. And he was talking about how some of them have like horrible lives at home. They may be homeless or dealing with some other issues like that. And he talked about how he can see this really, being valuable for them. So I think, our way in is through educating them. Our way in is through being able to compare the material to some of the experiences that they may be experiencing with some of their students, and giving as many different ideas and as many different perspectives as we can. That way we can try and reach a little bit of everybody.
Yeah, it sounds like it's actually maybe a little bit, I don't know, but it sounds like it's a little bit easier to maybe work through people who are already educating with kids, because they're already aware of how kids work and and I'm sure some probably have their biases and that sort of thing, but it seems like it would be easier than bringing an outside person to come in and work with the kids.
Right. And that's another issue that, we have to confront as well when going into this is we are outsiders ourselves, right? Like we are clinicians who are coming in to give this training, and they know exactly who we are not. We are not teachers. We do not deal with, high schoolers day in and day out. And so there's a bit of hesitancy there as well that we have to deal with. And so I think when we present this material, being able to sort of draw on those similarities and those somewhat level of understanding that we may or may not have with them, to really pull them in and really buy into what it is that we're trying to get them to learn.
Yeah, but you've worked with kids before.
Yes, I do. I do work with kids, but it's different, right? I'm working with students with autism and students with disabilities and things like that. Very different from, these are general education kids who have, predominantly typically developing and have just your general run-of-the-mill issues going on, whether within the school or at home. So there is some hesitancy there. And so, yeah, it's just one of the things that we have to think about.
So what's something that really surprised you when you went into this? Was there something like you were completely not expecting, or you thought would go a completely different way, but what's been your biggest surprise?
I think, probably in each sort of step of the way, how much buy-in and support that we have been getting from it. I expected a bunch of pushback probably at every step of the way, just because the approach that we're thinking about, the type of education that we're trying to push, and just because it's so opposite to, maybe not opposite, but it's so different than what's out right now, that I felt that there would be a lot of speed bumps along the way. And I think once we, have been given sort of time to talk about the information, to educate a bit, to go over the curriculum, just the feedback and the buy-in that we've had across the board has been awesome. And we continue to get calls from different districts and different other programs who are interested in collaborating with us. Yeah, so it's been awesome.
Wow, that's pretty cool. So as we're finishing up the session today, I'd like to ask, is there something that you've learned from this experience that you could share that any of the clinicians that are watching today, whether they're about to go back to work or going to go back to work on Monday, is there something that you can recommend they take with them in the clinic when they work with their next patient?
Yeah, I think experiences in general are, yes, they're all unique to all of us, but it's something that we all deal with and we all go through, I think, regardless of where we are. I think it's something that there's always going to be a connection and a relationship that can be had regardless of who your patient or your client is. And I think it's really important for us to sort of draw on some of those connections that we have and try to find some of those things. I think you can draw up anything like stress and just say stress and say, what are you stressed about? Well, I'm stressed about this. And right there, you have a connection of stress because everybody's got it, even if you think you don't. So I think being able to develop a connection with your clients and your patients it's critical. It's a great way to get buy-in. It's a great way, to help and facilitate that building of the rapport. And I think if you can do that, I think outcomes will be better. I think relationships will be better, and hopefully the world will be better as well.
That's a really good suggestion because already evidence shows us that um, people more likely to have positive outcomes if we do establish some sort of relationship. So that's a really good piece of advice. But thank you so much today, Michael, for joining us. And do you mind if on your bio page here that's going to be on the site, do you mind giving me something where people can contact you if they're interested in learning like more about this program, or maybe they're interested in like being a part of the program, and maybe you can send me that later and I can put it on your
Yeah,
bio.
yeah, definitely. I think currently just the easiest way is through email, and then whoever would like to contact, we can go from there. But yeah, my email's easiest.
Okay, well, thank you so much, Michael. I
Yeah,
appreciate your time today.
thank you.